staff and our dearest PGs, I take this opportunity to welcome you all to the PG Induction program of the year 2025. As we embark on today's program, please take your seats. From the nervous first steps we took as undergraduates, holding our instruments with trembling hands, to the confident doctors we became by the end of our journey, it has been nothing short of a transformation. Those sleepless nights, endless case sheets, bio sessions that made our hearts race, and friendships that made every struggle worthwhile were the years we learned not just dentistry, but discipline, patience, and resilience. And today, as you all step into this new chapter as postgraduates, it will feel like both an ending and a beginning. An ending of a familiar comfort zone and the beginning of a deeper, more challenging yet more rewarding journey. A journey where we don't just learn how to treat, but why and what more we can contribute to our patients, our profession, and to science. On that high note, I now call upon our Director cum Principal, Dr. Vijay V.K. Sir, to honor our Chief Guest, Mr. S. Balachandran Sir, Trustee, Padmavati Social Services, and Chief Engineer, RS Group of Institutions. Thank you for gracing this occasion with your presence, sir. Thank you, sir. The lighting of the lamp is a symbol of knowledge, learning, and the pursuit of truth. It signifies the removal of the darkness and the illumination of their growth. I now invite our Chief Guest, Mr. S. Balachandran Sir, and our Director, Dr. Vijay V.K. Sir, Dr. Kavita Ma'am, HOD from the Department of Oral Pathology, and Dr. Deepshika Ma'am, HOD from the Department of Periodontology, to light the lamp. I also request any one of the parents and any one of the PG to join the lamp lighting ceremony. Thank you all. Please take your seats. As we welcome our Director cum Principal, Dr. Vijay V.K. Sir, to share a few words.
A very warm good morning to everyone present here. And with the blessings of our Subramanian, brother, living God, and late Padmavati Amma, and our beloved Honorable Chairman here. I am very happy to have this day happening for all the postgraduates. It's a very special day to us also, for the institutions also, to the parents, and as well as to the postgraduate students also present. And I thank our trustee, Balachandran Sir, for being here in this mission schedule always. He is being one of the backbone of our college for everything. Thanks for your coming. And my beloved head of the departments and respected administrative officers, sir, and my colleagues who are present here, and the team who is organizing this function. Thanks for everything you have done here. And it gives me immense pleasure to welcome you all to this postgraduate induction program 2025-26 for esteemed institution. Today marks not just the beginning of your academic journey at the postgraduate level, but also to start of a deeper professional commitment towards dentistry, patient care, and the lifelong learning. First of all, let me congratulate each one of you securing a place in this institution. It's not merely an admission, but a recognition of your hard work, perseverance, and passion for dentistry. Postgraduate education is not just about acquiring an advanced knowledge and skills. It is about transforming yourself into a clinician, researcher, teacher, and a leader. who will make meaningful contributions to the society. Here, you will be trained to question, innovate, to analyze it critically, and to practice ethically. Our institution has always believed in nurturing holistic professionals. We provide not only the state of art, infrastructure, and clinical exposure, but also a culture to research, innovation, and academic excellence. But above all, we emphasize the values, compassion, integrity, and responsibility towards patients and community. And dear students, this journey will demand discipline, dedication, and determination always. You may face challenges and moments of self-doubt, but remember, you are never alone. Your teachers, mentors, and guides will be always be here to support you always, and make use of every opportunity, like via seminars, clinical postings, research projects, or community programs also will be in your life of your postgraduates. I urge you to adopt the right attitude by being humble enough to learn, confident enough to practice, and curious enough to research, and compassionate enough to serve always. As you begin this new chapter in our institution, I hope you will not only grow in academic excellence, but also evolve as responsible professionals and ethical human beings. And in the postgraduate curriculum, as I said, you will be having an advanced clinical knowledge, and the research-oriented publications also will be there, because there are many things to go through in the postgraduate curriculum. In our institutions, regarding the timings of the institution also, I am putting here as a small emphasis of what is the postgraduate curriculum, what we follow in our institutions here, because I think it has been already informed at the time of admission, but I have to emphasize very clearly what is happening in our institutions here for the past 3 years. This is the institution which started in 2006, and we have 6 postgraduate institutions, postgraduate departments we have, as you all know. And here we follow the timings of 8:50 for the postgraduates till 4:10 p.m. for the postgraduates. And after 4:10 p.m., the library will be open till 5:50. So 1 hour of library you can make use of this library here, and it will be also informed from the departments too. This is the timing regarding the timings. And regarding the timings, as I said, we are not we are not working in a computer company. We are as doctors, we are treating the patients. So sometimes the times may go till 4:30, 4:45 or 5:30 also. Some other departments in our college they work till 5:30 according to the patient's needs. So accordingly we should follow the timings here. But morning time is always must here at 8:50 a.m. To the departments always. And regarding the academic side, we will be always having a seminars, journal clubs, and we will be having a pedagogy in common, and we will be always having publications as we insist here by the regulations of the Dental Council of India. 2 publications per year in your academic curriculum is always must. So when you go out of the as a postgraduate, you will be having 6 publications in your hand when you go to a college for working or anything else. This is the first thing. And more than 2 is also always welcome here. It's not that it's mandatory for 2 alone. If you are having a 3 to 4 publications in your career per year, it's always welcome here. And we, myself and the head of departments and all the departments heads, including the basic centers, are here to support you always. Regarding the conferences, in the conferences you will be going for international and national conferences always, and always we used to urge and push students outside the college always to see the outside world always, because this is not the first time you are in the college, it is the post-graduation continuation of the UG. So when you have been in an undergraduate college, some of the colleges are right now also pushing the students from the first year outside to expose them always. But here we always push the students from first year onwards, from the first year BDS onwards, we push the students outside to go outside the country also for the presentation also we are doing right now here. So for the UG we are doing in this level. So you should not think of anything else in the postgraduate. For sure we will be pushed outside to the other institutions, other conferences related to international national levels also. So as a parents, you support them because you are the one who supports them to go outside the country. But regarding the money, regarding the expenditures, everything. but this is the first kind of exposure what they have there in their study time also, because after that only they will be going for the research, they will be going outside, because we have a MOU with some of the few universities in abroad countries, and we always push the undergraduate students to the outside countries also, because last 2 years we are following the same thing, and we are planning to send the postgraduates also for these kind of international conferences, not only in online. Directly also will be always the exposures will be good for them regarding the research oriented projects will be always there, because some of the students from the abroad they are doing a PhD programs here under the guidance of our head of departments and other staffs also here. So they are also making use of our college here. So our college also always welcome to the other universities which is in the abroad. They are also welcoming, they are always welcoming our students over there. So please make use of it. And regarding the exams, basic sciences we will be having in the first year within the curriculum, we will be having the postgraduate exams will be there under the guidance of our basic science departments. We will be having a theory classes in the afternoon times. So they will be very strict in their class, because we will be having a lots of classes and lots of seminars will be there in the basic sciences. So you please follow them very clearly. And secondly, I have to say emphasis on the cases, quotas, because main thing is the quotas and the cases what you do always. Because mainly if you are on time to the class and if you are present always in the department, you will be getting the cases. But if you are absent, you will not get a case. So make sure of you will be always present in the respective departments. Because as you know, we are under Tamil Nadu Engineering University. We have minimum for the undergraduates. We have a minimum attendance percentage of 80 to 85%. But being a postgraduate, we cannot say 80 to 85. Because being a postgraduate, we ourselves we should think of having a 95 to 90 minimum of 95% in the curriculum of postgraduate curriculum. That's what we say in our college always here. Because if you are not having an attendance, for sure you will be not allowed to write the exam here. For sure I will be from my side and from the head of the department side, I will be very strict in that. So make sure of all the academic activities and clinical activities, please do on time regarding the library destinations and regarding the main destinations. And regarding the publications and many things, you please follow in a very good. Because right now we are given a books to you right now, handbook. It was newly formulated here for the postgraduates. In that we are given a very clear subjects like academic excellence, research oriented, code of conduct, everything is given very clearly. You please follow that always here. And thanks for choosing our college always. And before you was undergraduate. நீங்கள் முதல்ல அண்டர்கிராஜுவேட்டாக இருந்தீங்க, அது லைஃப் வேறு, அந்த லைஃப் ஸ்டைலே வேறு. நீங்கள் என்ன படிச்சிருப்பீங்கன்னு என்னென்னு தெரியாது. புதுசாக நீங்கள் அண்டர்கிராஜுவேட் ஸ்கூலில் போயிருப்பீங்க, எல்லாமே புதுசாக கற்றுருப்பீங்க. புதுசாக கற்றுக்கிட்டு இப்போ இவங்க பிகம் MDS டாக்டர் ஹியர் வித் டிகிரி BDS. அண்ட் ரைட் நவ் வி ஆர் கோயிங் வித் போஸ்ட் கிராஜுவேட். ஸோ இப்போ நம்ம போஸ்ட் கிராஜுவேட் ஆகிட்டோம் அப்படின்னா ஆட்டோமேட்டிக்லி யுவர் இட் இஸ் ஷிஃப்டட் ஓவர் ஹியர் டு தி பேரண்ட்ஸ் ஆஸ் வெல் அஸ் டு தி ஸ்டூடெண்ட்ஸ் ஹியர் ஆல்வேஸ். ஸோ அந்த குரலுக்கு ஏற்ற மாதிரி பிஜி ஆகிட்டீங்க. ஸோ ப்ளீஸ் உங்களோட காலரை கொஞ்சம் தூக்கி விட்டுக்கலாம், யுவர் பிஹேவியரை கொஞ்சம் டிக்னிட்டியாக வச்சுக்கலாம். பிகாஸ் யுவர் டாக்டர், யூ ஆர் கோயிங் டு ட்ரீட் த பேஷண்ட்ஸ் ஹியர் ஃபார் ஃபுல் டைம். ஸோ ஆல் தி பேஷண்ட்ஸ் ஹூ கம் ஹியர் ஃபஸ்ட்டு நம்மளோட ருக்கை பார்ப்பாங்க. ஸோ இவங்க தான் டாக்டரான்னு பார்ப்பாங்க. அதுக்கு தகுந்த மாதிரி நம்ம ட்ரெஸ்ஸிங் சென்ஸ் இருக்கணும், அதுக்கு தகுந்த மாதிரி நம்மளோட டாக்கிங் இருக்கணும், அதுக்கு தகுந்த மாதிரி நம்மளோட பிஹேவியர் இன்சைட் தி இன்ஸ்டியூஷன்ஸ் இருக்கணும். இட்ஸ் நாட் இன்ஸ்டியூஷன், இட்ஸ் ஹாஸ்பிட்டல். ஸோ ஆல்ரெடி எல்லாம் ட்ரெயினர் போய் தான் வந்திருக்கிறீங்க. பட் சம் ஆஃப் தி திங்ஸ் ஐ ஹேவ் டு சே அகைன் அண்ட் அகைன் ஹியர் to hit the mind of the students here. So I am putting again and again these things of here. Meeting as a speaker here. So that's what I insist here always, because our chairman, he is not a politician and he is a very workable. He is a very workable person always. In the age of 84, he is an age of 84. We cannot imagine what he does and what he talks always, because he started his career at the age of 16. ஸோ அவங்க சொன்னால் கொஞ்சம் நான் இப்போ லாஸ்ட் ஒரு 3.5 years தான் இந்த காலேஜ் இருக்கிறேன். பட் அக்கார்டிங் டு திஸ் ஹிஸ்ட்ரி வாட் ஐ லேர்ன் அண்ட் வாட் ஐ எம் டாக்கிங் டு ஹிம் ரெகுலர்லி, ஹி மோட்டிவேட்ஸ் மீ ரெகுலர்லி ஆல்வேஸ் த்ரூ ஆல்வேஸ் வித் தி அட்வைஸ் ஆஃப் அவர் ட்ரஸ்டி ஆல்சோ, சசிசர் ஆல்சோ. பிகாஸ் ஒரு சின்ன விஷயம் எது இருந்தாலுமே வந்து ஹி வுட் கீப் இட் ஆஸ் இட் இஸ். அடுத்த ப்ரோக்ராம் அடுத்தது என்னதான் கேட்டுகிட்டே இருப்பார். இதுதான் லைஃப்னு சொல்லிட்டு எதுவும் பண்ணவே இல்லை அவர். ஸோ இன்னும் அடுத்த இன்ஸ்டிடியூஷன்ஸ் அடுத்து என்ன பண்ணலான்ற ஒரு இதோட தான் போயிட்டே தான் இருக்கிறாரு. So likewise, all the buildings what is constructed here in this area, what we have here is a small part of world what he has. But in and out of Tamil Nadu, he has many part of small constituents he has in this Tamil Nadu. So this is the part of 125 acres. Then starting in the building a rental department. So you go backside to the hostel till the end. Lots of buildings are there inside. To see many things are here, including the hostel, what he has constructed right now for the undergraduates and postgraduates also. So please have a look. So he is only an energy always here. So our energy so likewise you also should always be in a kind enough to work very hard, being an example for like a chairman what he does in the age of 84. So he is also one of the main iconic here to motivate everybody here. So likewise I also will be pushing you. Likewise our technical departments also will be there always to see you in the morning times. So please make sure of your presence and make sure in a very grand way. Thank you very much for listening. Thank you.
Thank you, sir. Department is the backbone of this institution, contributing not only to academic excellence but also to research, clinical training and overall professional growth. We now move on to the department presentation. Dr. Anand sir, Department of Biochemistry, Dr. Murugesan sir, Department of Pathology, Dr. Arjunan sir, Department of Microbiology, Dr. Saundrapandian sir, Department of Pharmacology, Dr. Salman sir, Department of General Medicine, Dr. Balaji ma'am, Department of General Surgery, Dr. Suresh Kumar sir, Department of Oral Pathology, Dr. Kavita ma'am, Department of Oral Medicine and Radiology, Dr. Chandrakala ma'am, Department of Public Health Dentistry, Dr. Umesh sir. Now we will begin with the clinical departments. First up, we have Dr. Ranjit Varghese sir, Head of Department from the Department of Prosthodontics and Crown and Bridge.
Respected Principal Dr. Vijay, my dear co-faculty and dear new postgraduate students. It gives me great pleasure as Head of Department of Prosthodontics to welcome new postgraduates to my department. Of course, welcome to all the other postgraduates too. Definitely, I'm sure because of our interdisciplinary activities, we all meet each other. As I'm sure all of you would have heard that as a dentist, what do you mean by dentist? It is typically we call a combination of a carpenter, engineer and an artist. And I'm sure we're going to, this is to show, we're going to have this combination of technicality in our department, specifically the maxillary prosthodontics, where you will almost reach a combination of a carpenter, engineer and an artist. And I'm sure, hopefully all of you will kindle the interest more and more in this age of digitization and all that. So this is just a small introduction to my faculty. This is a faculty we have in our department. We have a professor of person and we have some of the senior lecturers and leaders. So this is a small combination, division of prosthodontics what you're going to learn. It's just for you. I'm sure you will start learning once you start your first year. And we have lots of CD programs. We kindly invest in a lot of CD programs. We have lots of patencies going on. So it is more of a very, very highly technical department. And I hope all of you enjoy the technicality. So unless you enjoy the technical part of it, you might find it very strange. And of course, this prosthodontics program is absolutely cannot be achieved only as a team. So I'd be happy if I can see my postgraduates. See if I can see the prosthodontic program. I just want to see all of it. So these are some of the programs we have conducted in the postgraduate department specifically. So we try and keep your interest always with CD programs, with updates, and we have lots of updates going on the faculty side as well as the postgraduate side. These are very important now. Research, specifically research in public health. So it's just a small. We have lots of special cases. So as I told you, you can see some of those are basically related to IT, creative and artistic. So we have to be extremely artistic in our discipline. So I hope all of you have a very good teamwork, and with this age of digitization and AI, I hope you are all well versed with it, better than our generation. So I am hoping all of you will use this age of digitization and AI in prosthodontics and acquire a very good deep knowledge. And I hope all of you have a fruitful program, teaching program in the coming 3 years. Wishing you all the best. Thank you.
Good morning. With the blessings of respected our Honorable Chairman, Vijay Dr. Kupuswamy Avargal, and respected dignitaries, Dr. Bachandra sir, Director and Principal, Dr. Vijay V.K. I welcome all dear parents for the program, and I appreciate the efforts which you have put to see your children get and pursue the postgraduate course in the first place. Secondly, I would like to congratulate all the postgraduate students for making their dream a reality. I am Dr. Vinay Kumar from the Department of Conservative Industry and Endodontics. This is our team of staff members. We have Professor Dr. Vinu Subramaniam, readers Dr. C.B. Swami, Dr. Surya, Dr. Abhinaya, senior lecturers Dr. Devipriya, Dr. Anita, Dr. Sayojya, Dr. Dharani, and Dr. Dhanisha. Basically, in conservative department, we have three domains which we deal into. One is conservative, that is the restorative part. The second is endodontics, and third is the aesthetic dentistry. We give equal weightage to all the domains of dentistry in our postgraduate curriculum. These are the facilities what we have in our department, which includes the preclinical, individualized preclinical labs for the postgraduates and the clinical arena. And we have a seminar hall with virtual projector and audio visuals. We have state-of-art dental operating microscopes to use, and various equipment for the root canal treatment. We have instrument retrieval system, and we have different types of observation systems also. These are the few of the special cases which have been treated by our postgraduate students. As you can see, this is the internal resorption case, the aesthetic smile design. This is a rehabilitation of the fractured tooth. And we have around 2,000 patients input around in a month, in which we have 857 in the postgraduate department and 1,336 around in the UG section. These are the various research activities which have been undertaken by our PG students. These are completed progress research activities. And we follow the Dental Council of India syllabus, both in academic as well as clinical aspects. These are the various laurels the postgraduates have won in the national conferences. And I'm proud to say that after the inception of the department, we are winning in almost all the national conferences. These are the latest prizes which the PGs have won. And these are the various publications which are done by our PG students and staff, which included in PubMed as well as Scopus Index journals. And also our staff member, Dr. C.B. Swami, has a patent to his credit which deals with the pre-filled anesthetic syringes for local anesthesia. Thank you, one and all.
As well as expansion done and immediate implant placement. Whereas in this case, we have done a case where there was a rich preservation, that is the tooth was fractured, so we had to preserve a part of the tooth and then we placed an immediate implant. So most of these cases have been done by the postgraduates itself under our guidance. So I think it's a very, very important aspect, because in many colleges Studies, Dr. Jai Shakti has published one article that all these are in the permanent index journals, and Dr. Sumati, the short studies are going on. So these are all the list of the short studies that have been done now. And another very important thing which we have achievement we have this year is we have an ISP grant, which is a grant which is given by the Indian Society of Dermatology. So one of our postgraduate student, Dr. Kavin P.N., he has got a grant. So the grant is something which is given by the association, and the entire the thesis, that is the implants, everything will be provided by the association. So it's a great achievement by our first year postgraduate student. Even Dr. Rimita has applied for the grant, but we are just waiting for the proposal. And these are the various short studies. So as I told you, it's not only postgraduate students, the interns also are actively involved in our department. So these are few of the studies as well as publications which have been done in our department. So with this, I would like to welcome all the postgraduates. I just wish, as I told you, the postgraduates, I wish all the postgraduate students a great success, and I just would like to end with the quote of Swami Vivekananda: the heart to feel, the brain to conceive, the hand to work. So make yourself a dynamo. So I wish all of you shine like dynamos and achieve all your dreams in this our college. I welcome you wholeheartedly. As well as expansion done and immediate implant placement. Whereas in this case, we have done a case where there was a rich preservation, that is the tooth was fractured, so we had to preserve a part of the tooth and then we placed an immediate implants. So most of these cases have been done by the postgraduates itself under our guidance. So I think it's a very, very important aspect, because in many colleges the postgraduates do not get the feel of doing many things by themselves. But in our college, they have the privilege of doing it themselves under our guidance, and we are really proud of that. So going on to research activity, other than their thesis, they always do a lot of short-term studies. So these are few of the research studies done by postgraduates, and most of them have been published. So these are the third year student, Dr. Harita. She has 2 publications to her credit. Dr. Niroshni, also a third year student. She already has 1 publication and there's 2 short studies. Dr. Jai Shakti has published 1 article that all these are in the permanent index journals, and Dr. Sumati, the short studies are going on. So these are all the list of the short studies that have been done now. And another very important thing which we have achievement we have this year is we have an ISP grant, which is a grant which is given by the Indian Society of Dermatology. So one of our postgraduate student, Dr. Kavin P.N., he has got a grant. So the grant is something which is given by the association, and the entire the thesis, that is the implants, everything will be provided by the association. So it's a great achievement by our first year postgraduate student. Even Dr. Rimita has applied for the grant, but we are just waiting for the proposal. And these are the various short studies. So as I told you, it's not only postgraduate students, the interns also are actively involved in our department. So these are few of the studies as well as publications which have been done in our department. So with this, I would like to welcome all the postgraduates. I just wish, as I told you, the postgraduates, I wish all the postgraduate students a great success, and I just would like to end with the quote of Swami Vivekananda: the heart to feel, the brain to conceive, the hand to work. So make yourself a dynamo. So I wish all of you shine like dynamos and achieve all your dreams in this our college. I welcome you wholeheartedly.
This is our department. Dr. Krishna and Dr. Yogi is the leader, and Dr. Vishwar and Vishke and Dinesh are senior lecturers. This is our UG clinic. This is our PG clinic. And another OT. So we have a small OT complex we carry. As various instruments what we have used. In our department, we do various type of major and minor surgeries. I displayed a few of them. This is full of implant case. This fractures and very complex fractures are. This one case we doing action. This is sublingual granuloma case. Doing orthopedic case like the cosmetic surgeons we do. And cleft lip and cleft palate. So this various surgery. And as usual, as I have told, our PGs also we doing various type of research work and present this various type of papers in conference. And we have an attachment with the various hospitals like Garo Hospital and Mutula, and we are performing surgeries there. And this is according to this form, we have to do this PG program for 3 years. As first years, what you have to do for preclinical works and wiring works and peripheral postings. These postings will be done in the various hospitals in various departments. Thank you. Wish you all time.
Respected parents, respected principal, respected audience. First, I'd like to thank the management for giving this opportunity to be the head of the department. ಎಲ್ಲ ಪೇರೆಂಟ್ಸು ಕನ್ನಡ ಸೊ ನಮ್ಮನ್ನು ಮುಗಿಸಿ ಜಾಯಿನ್ ಮಾಡೋ ಹೋಗ್ಬೇಕು. ಸೊ ಪಿ ಡಿ ಒ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಇದು ಕೊರತೆಗೆ ಸಾಂಗ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್. ಸೊ ಪಿ ಡಿ ಒ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಯಾರು ತಿಳಿಸಿಲ್ಲ. ಸೊ ಯುವರ್ ಸೆಲ್ಫ್ ಹ್ಯಾಂಡಲ್ Nitish, thank you sir. So it's made hope and the department will really thanks. Sariya, okay, thank you Jews. So before I start my presentation, so these are my helping hands. So I have my two all female candidates, Dr. Ashia, Cesar Reader, Dr. Narmada Reader. I have 3 lecturers, Dr. Karthika, Dr. Malika, and Dr. Shanika. So எல்லாத்துக்குமே தெரியும். So our dental college usually consists with 2 parent institutions. So நம்ம எதுக்கு கீழே வரும் அப்படின்னு பார்த்தீங்கன்னா தமிழ்நாடு இந்தியா யூனிவர்சிட்டி கீழே இருக்கும். ஸோ இது எதோட கன்சர்ன் பார்த்தீங்கன்னா டென்டல் கவுன்சில் ஆஃப் இந்தியா. ஸோ டெல்லியில் சென்ட்ரல் கவர்மெண்ட்டில் கண்ட்ரோல் பண்ணக்கூடியது டென்டல் கவுன்சில் ஆஃப் இந்தியா, தமிழ்நாடு கண்ட்ரோல் பண்ணக்கூடியது இந்த தமிழ்நாடு எம்ஜிஆர் மெடிக்கல் யூனிவர்சிட்டி. ஸோ இந்த சைட்டில் போனீங்கன்னா ஒரு போஸ்ட் கிராஜுவேட்டுக்கு என்ன பண்ணணும், எப்போ பண்ணி முடிக்கணுன்றது கிளியர் கைடன்ஸோடு கொடுத்துருக்காங்க. ஸோ இன்னும் ஒரு விஷயம் நான் சொல்ல வேண்டியது, யூஜியில் தான் நீங்கள் டீச்சர்னு சொல்கிறோம், பிஜியில் இருக்குது அஸ் ஒன்லி எஸ் அ கைட். ஸோ ஒரு டீச்சர் என்ன செஞ்சாங்களோ யூஜியில் பிஜியில் செய்யணும்னு எதிர்பார்க்க முடியாது. ஸோ எவ்ரி திங் இஸ் கிவன் ஆன்லைன் வாட் யூ ஆர் சப்போஸ் டு டூ. ஸோ ஒரு கைடோட வேலை என்ன செய்யணும்னு முன்னாடியே சொல்லிடுவோம். ஸோ யூஜி மாதிரி ஸோ இப்போ முடிக்கணும் அப்படின்ற சொல்கிற நிலைமையில் இப்போ கிடையாது. We have crossed the age, so we take the responsibility what you are supposed to do before each every time. So this is university's curriculum. So first 7 months என்ன பண்ணணும், அடுத்த 7 months என்ன பண்ணணும், எக்ஸாம்ஸ்க்கு முன்னாடி என்னென்ன ரெக்குயர்மெண்ட் அப்படின்னு இருந்துட்டா போதும். ஸோ இது வந்து டென்டல் கவுன்சில் ஆஃப் இந்தியா. ஸோ இது வந்து தமிழ்நாடு யூனிவர்சிட்டியை கவர்ன் பண்ணுறது. ஏன் இந்த 2 பாயிண்ட்டையும் நான் இன்சிஸ்ட் பண்ணுறேன் அப்படின்னு பார்த்தீங்கன்னா, யூனிவர்சிட்டியிலேருந்து வருஷம் ஒரு இன்ஸ்பெக்ஷன் வருவாங்க. ஸோ ஒரு போஸ்ட் கிராஜுவேட் என்ன முடிச்சிருக்கணுமோ அதை செக் பண்ணுறதுக்கு நாங்கள் சொன்னால் பத்தாது, அவங்க இன்னொரு காலேஜில் வந்து ப்ராப்பராக வெரிஃபிகேஷன் பண்ணுவாங்க. ஸோ நீங்கள் நினச்சிங்கன்னா சரி பாதி பண்ணலை ஸ்டாஃப் பண்ணுவாங்க, அப்படி கிடையவே கிடையாது. ஸோ இன்னொரு யூனிவர்சிட்டியிலும் வந்து ப்ராப்பராக செக் பண்ணுவாங்க. ஸோ இவங்க செக் பண்ணதை கரெக்டான செக் பண்ணுறதுக்கு சென்ட்ரல் கவர்மெண்ட் டென்டல் கவுன்சிலுக்கு வருவாங்க. There will be 2 inspections which is mandatory every year. So every 6 months நம்ம ஒர்க்கை கரெக்டாக வச்சுருந்தோம்னா we don't need to worry about it. So நான் சொல்ல வர பாயிண்ட், every 6 months keep your record updated which is already been given what you are supposed to do in the specified times. So this is just few infrastructures. We have UG clinic, PG clinic, so few play areas, so all necessary equipments as prescribed by these universities. So we have, as we know that it's a growing institution. So இப்போ தான் இந்த 4th batch எடுத்திருக்காங்க. So patient flow just increase ஆகிட்டே வருது. ஸோ என்ன மினிமம் ரெக்குவயர்மெண்ட்டோ எல்லாத்துக்கும் தேவையான பேஷண்ட்ஸ் ஃப்ளோ இன்க்ரீஸ் ஆகிட்டு இருக்கு. ஸோ ஐ ஆல்சோ தேங்க் பப்ளிக் ஹெல்த் டிபார்ட்மெண்ட்ஸ் பிகாஸ் எங்களோட சேர்ந்து ரெகுலராக கேம்ப் போயிட்டே இருக்காங்க. ஸோ ஐ ஆல்சோ தேங்க் பிரின்சிபல்ஸ். ஸோ எங்கள் ஃப்ளோ ரெகுலராக பார்த்தீங்கன்னா லாஸ்ட் 2 இயர்ஸாக நல்லா இன்க்ரீஸ் ஆகிட்டு இருக்கு. So we request PGs to do regular activities. So PG works நான் 3 விதமா பிரிப்பேன். ஒன்று academics, ஒன்று clinics, ஒன்று research. Academics நான் பண்ண வேண்டியது செமினார்ஸ் பண்ணணும், ப்ரெசன்டேஷன்ஸ் பண்ணணும், ஜேர்னல் பண்ணணும். ஸோ அது வருஷத்துக்கு எத்தனை பண்ணணும் அப்படிங்கிற போட்டா முன்னாடியே சொல்லிடுவாங்க. ஸோ கிளினிக்ஸ் பார்த்தீங்கன்னா பேசிக் சிம்பிள் ஸ்கேலிங், ஃபில்லிங், எக்ஸ்ட்ராக்ஷன்ஸ், சரிங்களா? இது போக அட்வான்ஸ் என்ன தேவையோ செடேஷன்ஸ். ஸோ நம்ம பண்ண முடியாத விஷயங்கள்ல சர்ஜரி சொன்ன மாதிரி வி ஹேவ் ஓடி காம்ப்ளெக்ஸ், மைனர் ஓடி இருக்குது, மேஜர் ஓடி இருக்குது. ஸோ இது போக நம்ம என்ன பண்ணுறோம்னா பெரிஃபரல் ஹாஸ்பிட்டல்ஸ். ஸோ வி ஹேவ் 3 மெடிக்கல் காலேஜஸோட டைப் பண்ணியிருக்கோம். KMCHோட வச்சுருக்கோம், கங்கா ஹாஸ்பிட்டல் வச்சுருக்கோம். இங்கே நியர்பை 100 பெட் ஹாஸ்பிட்டல்ஸ் இருக்குது. வி ஆல்சோ பிளான் நம்ம காலேஜுக்குள்ளே இன்னொரு ஹாஸ்பிட்டல்ஸ் வரும்போது கூடிய சீக்கிரம் வந்துடும். ஸோ இதில் பார்த்தீங்கன்னா 3 months பெரிஃபரல் போஸ்டிங் போவீங்க. ஸோ இண்டிவிஜுவலாக நீங்கள் பண்ணுறதுக்கு எல்லாமே கைட் பண்ணுவாங்க. ஸோ யூ கோ ஃபார் அனஸ்தீஷியா, யூ ஹேவ் பீடியாட்ரிக்ஸ், யூ ஹேவ் இன்டிரோஸ். So we mainly treat with special care. So we have 2 special schools which have been attached to us, Kauman Prashanthi Academy. So you have 500 special schools வச்சிருக்காங்க. So இது government run organizations டோட்டலாகவே டைப் பண்ணியிருக்காங்க. ஸோ ரெகுலராக நம்ம கேம்ப் போடுவோம். ஸோ என்னெல்லாம் பார்க்க முடியலையோ you can have a look of that. ஸோ ஸ்டார் ஸ்பெஷல் ஸ்கூல் இது ஒண்டிபூதில் இருக்காங்க, நம்மளோட MOUஸில் இருக்காங்க. ஸோ எல்லாமே ரெகுலராக என்னென்ன தேவைகளோ ஸ்பெஷல் சில்ட்ரன்ஸ் எல்லாமே ரெகுலராக பண்ணிட்டு இருக்கோம், சரிங்களா? ஸோ we always encourage children to go for community oriented services. ஏன்னா நிறைய அந்த சூழலை சுற்றி நிறைய அவேர்னஸ் கொஞ்சம் கம்மியாக இருக்குது. லாஸ்ட் இயர் we got 100 schools to be screened. ஸோ லாஸ்ட் இயர் மட்டும் கிட்டத்தட்ட ஒரு 150 ஸ்கூல் கேம்ப்ஸ் நடத்தியிருக்கோம். ஒரு 17,000 பிள்ளைகளை ஸ்க்ரீன் பண்ணிட்டு ஒரு 6,000 ஸ்கூல் ஸ்டூடெண்ட்ஸ் ஸ்க்ரீன் பண்ணியிருக்கோம். இட் இஸ் ஜஸ்ட் அன் கொலாபரேஷன் ஃப்ரம் அவர் மேனேஜ்மெண்ட்ஸ் வித் த தமிழ்நாடு கவர்மெண்ட். We thank you. So these are some of the achievements from our staff side. So we promote all our students, staffs and students to go for chief guest lectures. So we have also make our staff to participate in international conference also. So these are few of the publications which our staffs have gone through. சரிங்களா? these are reference books. நீங்களோட ரெக்குயர்மெண்ட்ஸ் எல்லாமே யூனிவர்சிட்டி கரிக்குலத்தில் இருக்கு, அதை கோ த்ரூ பண்ணுங்க. ஸோ ஒரு ஸ்டாஃப் எல்லாம் சொல்லணும்னு எதிர்பார்க்க வேணாம், கிளியராக உங்களுக்கு இருக்கு. If you do everything on time, you will be very well. So I welcome all you everyone to join. Thank you.
Blessings of Chairman, Principal Sir. On behalf of Department of Mathematics, I extend a warm welcome to our newly joined postgraduate students. So our department mission is to become pioneer in holistic authentic education by providing advanced patient-centric care, integrating modern technology, fostering ethical learning, and contributing to both community and authentic research. So the main mission is to empower patient-centered education. So both patients as well as students has to encourage education and innovation. So our department always pushes the students as well as faculties to innovation and adopt modern technologies. So our department has started from since 2008. So we have been practicing since 2008. So our department comes under the India Medical University and Medical Council of India. We are following all the equipments and the facilities according to the norms. These are some of the staffs in our departments. Actually, Dr. Rajsekhar sir, Dr. Neetika Babu, Professor, Dr. Arun Tibat, Reader, and some of the senior lecturers are Priyanka, Dr. Priyanka, Dr. Ayubu Kitna, Dr. Ramkumar, and today Dr. Shobhita. Since 2021, we have an intake of 3 postgraduate students. So all the postgraduate students, these are the postgraduate students currently working in our department. So we have footfall of around 10,000 cases annually. So we are actively involved in community also. So these are all the census of the last 2 years. So each month we have average of around 900 to 1,000 cases. So our PGs, faculties have been always encouraged to actively participate in research and innovation and publications, patents, especially in modern technologies involving AI in robotics, clear RNA therapy, digital 3D printers. So those technologies we are also incorporating in our day-to-day practice. So these are some of the achievements of Department of Mathematics. So we have received the award from Indian Orthodox Society as well as Indian World Records for contributing maximum number of authentic brains in a single day, which is worth 9 lakhs. This is some short video. actively participate in community programs through the outreach activities as well as camps. Some of the special cases. So we also adapt modern technologies like infrared scanners, digital printers, 3D scanners and 3D printers, so clear aligners, micro implants. So we always adapt to modern technologies. So one of the future goals is to advance orthodontics through technology and research, foster professional excellence, and enhance patient care with innovation and integrity. So once again, I welcome all new personal students to our department.
Thank you, sir. Finally, we have Dr. Lakshmi Alsan, sir.
And radiology. And these are college OP statistics of the year 2022, 23, 24 and 25. Since the COVID-19 pandemic, outpatient statistics at RBS General College and Hospital initially declined. However, from 2022 onwards, there has been a steady and significant increase in patient flow per day. The growth is largely due to the regular organization of medical camps in surrounding areas of schools which have played a vital role in raising awareness and accessibility. We are proud to say that we have a memorandum of understanding with 55 villages surrounding SULUR. Currently, we have a threefold increase in the number of OP cases daily. In addition to overall increase in outpatients, there has been a noticeable rise in the number of specialty cases being treated at the hospital, reflecting the expansion of scope and reputation of the institution's medical services.
Thank you, sir. We have now come to the most interesting part of today's program. On to the stage to introduce themselves and share their aspirations with us. First up, I call Dr. Ajay Ishwar.
Hi, myself Ajay Ishwar. I have done my UG CSI Dental College Madurai. Thank you.
My name is Subhashishmi. I've done my UG from Ramakrishna Dental College and Hospital. I am very excited to start my journey here as a postgraduate. Thank you.
Myself, Dr. Divya. I did my UG in Doctors Dental College, Clinical Imaging. I thank everyone in the college for giving me an opportunity to do the post-graduation and be a best part of my career. Thank you, everyone.
Good morning everyone, I am Dr. Pavitra Rani. I did my UG in Government Dental College, Chennai. I look forward to learn clinical skills in my PG journey. Thank you.
I am Dr. Subhash. I done my UG in Induction Dental College. Thank you.
My name is Dr. Shachika. I completed my undergraduate degree in Ramakrishna Dental College and Hospital. Very happy to have that.
Myself, Nivedita. I have done my UG from Adi Parashakti Dental College and Hospital, Neelmanuttur. My hearty wishes for all the PGs joined here. I am happy to be part of this institution. Thank you.
Myself Maniman. I have done my UG in Sankaracharya Dental College, Shiva. Thank you.
Dr. Adarsh. I completed my UG in JJK Dental College. Thank you.
I'm Dharani. I thank my parents and Almighty for the opportunity of joining my teaching, and I congratulate everyone here. Thank you.
Present here. I'm Kiran and I did my UG at Savita Dental College. So I'm looking forward to do my PG here.
Good morning everyone. I am Nitish Kumar. I did my UG at Sri Mugamika Institute, Kanyakumari. Thank you for giving this opportunity.
Principal, heads of the department. I am Nitish. I did my UG here in RBS Dental College. I passed out last year and doing my PG in the same institution as a personal choice as I have got supportive staffs here. So all the best to all of my colleagues and hope increase.
Dr. Gautam from UG at Madhuraj Hospital.
I am Dr. Asha Ishwarya. I have done my UG in Vivekananda Dental College and all the best to every and congratulations.
I am Dr. Kalki. I completed my UG in Adi Parashakti Dental College in
growth and a lot of memorable experiences in this new chapter of your journey. No event is complete without expressing our gratitude to the people who made it possible. To do the honors and convey our heartfelt thanks, I now invite Dr. Priyadashna ma'am to deliver the vote of thanks.
Good morning, everyone. On behalf of MDS College and Hospital, it is my privilege to extend a heartfelt vote of thanks to all who have contributed to making today's postgraduate orientation program a memorable and meaningful event. First and foremost, I would like to express our sincere gratitude to our chairman, Dr. K.V. Kuppusamy Ayya, for his blessings and constant encouragement. I would like to also extend our gratitude to Balachandra sir, trustee and chief engineer of RDS Group of Institution for his valuable support and guidance towards the growth of our institution. Thanks for gracing this occasion, sir. Our heartfelt thanks also goes to our principal cum director, Dr. Vijay V.K. sir, for his unwavering commitment to academic excellence and motivating our new postgraduate students. Your words of wisdom and encouragements have truly set the tone for their academic journey. I also take this opportunity to thank our respected heads of the departments and all faculty members whose present and continued support always motivate our students to strive for excellence. A special word of thanks to the parents who have joined us today. Your encouragement, support and trust in our institution plays a vital role in shaping the success of our future specialists. We deeply value your presence and support. And finally, to our fresh batch of postgraduate students, thank you for your enthusiastic participation. We hope this orientation has given you a glimpse of opportunities, responsibilities and the vibrant academic life that awaits you here. We wish you all a great academic success, fruitful research and a rewarding journey ahead. A warm welcome to the RDS family. Before I conclude, I would like to thank our AO sir, the organizing committee, the technical team, the student coordinators, whose dedicated efforts has ensured the smooth conduct for this program. Thank you once again to everyone for being part of this wonderful occasion. Wishing you all a pleasant day ahead. Thank you.
Happy morning. I am father of Dr. G. Muthesvi. I have been associated with RVS. Earlier I was there in Arts College. It's a good place to learn, and I hope all the students of first MDS will enjoy and learn things from this, because education is something very important and we have to be very practical and we have to be very enthusiastic. So with these few words, I thank the organizers and given me an opportunity to address in front of you. Have a good day and enjoy your life in RVS. Thank you.